Hi, this is a continuation of our discussion of allergic rhinitis. We'll begin with the diagnosis of allergic rhinitis. The physician will often be able to diagnose allergic rhinitis from your symptoms and your personal and family medical history. The physician will ask you whether you have noticed any triggers that seem to cause a reaction, or whether it happens at a particular place or time. The physician will examine the inside of your nose to check for nasal polyps. Nasal polyps are fleshy swellings that grow from the lining of your nose or sinuses. They may be caused by the inflammation that occurs as a result of allergic rhinitis. Allergic rhinitis is usually confirmed when medical treatment starts. If you respond well to antihistamines, it's almost certain that your symptoms are caused by an allergy. Allergy testing. If the exact cause of allergic rhinitis is uncertain, the physician may refer you to a specialist, an allergist, for allergy testing. The two main allergy tests often used are a skin prick test. Here, the allergen is placed on your arm or back, and the surface of the skin is pricked with a needle to introduce the allergen to your immune system. If you are allergic to the substance, a small itchy spot called a welt will appear. Blood may also be taken for specific immunoglobulin E antibodies in your blood. These are called IgE. This is another way to test and to aid diagnosis. Your immune system produces an antibody in response to a suspected allergen, and this is an IgE antibody. Further testing may also be recommended. In some cases, further tests may be needed to check for complications, such as nasal polyps or sinusitis. For example, you may need a nasal endoscopy. Here, a thin tube with a light source and video camera at one end is inserted up your nose so your doctor can see inside your nose. A nasal inspiratory flow test may also be done. Here, a small device is placed over your mouth and nose to measure the airflow when you inhale through your nose. A CT scan of the sinuses may also be helpful. Complications that result from allergic rhinitis. In other words, problems that may be associated with hay fever include reduced quality of life. Hay fever can interfere with your enjoyment of activities and cause you to be less productive. For many people, hay fever symptoms lead to absences from work or school. Poor sleep. Hay fever symptoms can keep you awake or make it hard to stay asleep, which can lead to fatigue and a general feeling of being unwell. Worsening asthma. Hay fever can worsen signs and symptoms of asthma and produce more coughing and wheezing. Sinusitis. Prolonged sinus congestion due to hay fever may increase your susceptibility to sinusitis, an infection or inflammation of the membrane that lines the sinuses. Ear infection. In children, hay fever often is a factor in middle ear infections. Now, prevention is key. There's no way to avoid getting hay fever. If you have hay fever, the best thing to do is lessen your exposure to the allergens that cause your symptoms. Take allergy medications before you're exposed to allergens, as directed by your doctor. Well, we'll continue on the next video. I hope this helps. Have a good day.